Hi, it's Dr. Jen and my husband,
Hi.
Chip. Okay, we're going to start a new series on the YouTube where we are just talking about life and things that come up on the daily. And we started this because we were talking about things and I'm like, we should just do YouTubes about this. So we have our tea. Cheers, Chip. It's a good little adaptogen blend. Okay, so stay tuned because we are going to be talking about ALF devices and oral surgery and polyester and how it affects our health. So, well, first, Chip, you got surgery last week for your tooth. Do you want to tell everyone what happened with that? Because it's been
Yeah, so I was in a bike accident as a child. I think, 13, and one tooth broke off right at my gum line, and the other one, the whole tooth came out. So years ago, I had an implant put in, a titanium implant put in Toledo at, what was that guy's name that I went to?
I don't remember.
I have to think about it.
Oh yeah,
Who was it?
because it was a mess, right?
Yeah, big mess. Who was it?
I don't think we should
That's
bad stuff.
yeah, it's okay.
Brody?
No,
An associate? No, not Brody. It was
no, it was
like a
like,
big name.
yeah, a big name. I never,
Yeah.
but
Well,
that's okay. So I got an implant put in, and it looked like I got beat really badly. I mean, my whole face was just like hugely swollen, and I had ectopic bone growth coming out of my gums for a long time. And so then the boys get their ALF devices. It's like a homeopathic orthodontic treatment.
Well,
Hold on, let me.
well, we will define ALF device shortly after Chips.
Okay. So come to find out, this Dr. Prather does implants, breast implants, oral implants.
Yeah, which
She uses,
implant is
yeah.
on the body.
So zirconia or zirconium is like a biocompatible ceramic. So a lot of I don't know what you call biologic dentists use these zirconium implants because they're more biocompatible with human body. So like $7,000 later, I had my tooth taken out last week, and she put an implant in, but it takes 4 to 5 weeks. I'm sorry, 4 to 5 months until I can get a tooth. So I have this lovely retainer with a little tooth colored in it.
It's like
I
a
don't look,
hockey player.
I don't talk that well with it in, as you can tell.
You do have like the size and like body type of a hockey player.
Yeah, so I should just not leave it in, leave it out. Oh, it's crazy because Dr. Prey there, she drew my blood and spun out my rich fibrin, also called PRF, and made a little clot to put in there. And so she used that. And they also use ozonated water to irrigate after she pulled the tooth out. So the day after I had the tooth pulled out, I mean, I wasn't swollen at all. The only reason you can tell that I had the tooth pulled out is because she had to cut the gum tissue and suture it closed. So no swelling hardly, and really not a whole lot of pain at all. So it was a night and day difference from the first experience. I would say like the zirconium implants and the, you know, quote unquote biologic extraction is definitely the way to go.
Yeah. I mean, you didn't even take anything for pain, just arnica.
Arnica.
Yeah,
Yeah.
it was pretty cool. Yeah, so that's a journey because if you replace your tooth, I mean, our teeth, they conduct, energy in our body. And there is a whole dental chart I'm looking at over in my office that our teeth, they correlate to different meridians and different organs in our bodies. It's very big, especially root canals and stuff. This is a problem. And you didn't have to have root canals on those, correct? No,
No, I did. That's why I had to have the implant put in.
Yeah.
Because what happens when you have a root canal, and I can't have that retainer in when I drink hot tea, it'll deform it. But yeah, when you have a root canal, after a while, your bone around the root of your tooth starts to resorb, so to go away, so you lose bone density. So they have to pull the tooth out, put the implant in, so that you don't lose bone density in your jaw.
Yeah. And it was interesting because Chip got a full body thermogram. What was that, 2 years ago? And it showed like inflammation up there. So, we're just trying to figure out what's causing it.
It'd be interesting to see, like, after this
get a
is done,
repeat
get a
with
repeat.
with our new girl in Tennessee.
Yeah.
Yeah, it's crazy because our airway in our teeth matters so much with our health. And it's not just like cavities or gum health, like it's deeper. And it's always part of an intake with the patient because sometimes like that is the key. And most of the older patients I see that are a disaster when it comes to health, they have multiple root canals. But for me to convince them to get it taken care of, it's hard. I mean, a lot of people have trauma with dental procedures. I know, like, does that happen to Chip when he was so young before we even met? Like, it's tough.
Implant though, like while we were together.
Yeah, no,
Yeah, yeah.
I mean, and that's the thing, like, we're sharing Chip's story because, I mean, God's using it. We want to share it. Chip's so much more resilient with it. The kids think it's funny when he eats without his tooth. So, and I'm still attracted to Chip, so it's all good too. But okay, so the ALF device. So ALF stands for Advanced Light Wire Functional Therapy Appliance. So ALF. And I just got mine last week and I was kind of a mess the day after, right?
Yeah.
I'm still speaking a little weird because my tongue hurts, the sides of my tongue. And to chew hurt really bad the first day or two. And the kids, the boys were like, now you know how we feel pain and how we felt. And I'm like, yeah, but I already went through this when I had braces as a kid. But I need some more palate expansion. And my big problem is a tongue tie. And that is causing problems for me as I age and I lose collagen. It's just been a different swallowing for me, and I couldn't figure out why. And then I put the two and two together. And for a Christmas present for myself, I got an airway evaluation. So, I got mine in. I actually have these bumps in my mouth. I'll have to put a picture up. I forget what they're exactly called, but it was from clenching my teeth so much at night. See them like isn't that crazy? And I would have this like neck and trapezius pain and I like always need Chip to like massage it, and his like, Jenny, you're so healthy. Like, why do you have this chronic pain?
Because she works out too much.
But that wasn't it because it started in residency. So I thought that it was because of, well, working out, but then I knew it wasn't. But I thought it was typing on computers and stress. And it could be a little bit of that too, but that clenching. And I would actually like clench my teeth so much, they would almost like crack. So, but anyway, if you don't have good cranial sacral rhythm, if you're clenching at night, you're like, first of all, if you can't breathe and you're clenching to bring your airway forward and grinding your teeth for that, that is not, your body is not in a safe place. You're in sympathetic overload. So I'm just excited for this journey to show that's kind of what it looks like. But I do have in my highlights on my Instagram, our kids' journey, and they've gotten such good, gentle palate expansion. And I've been doing cranial on them. And then I found a really good cranial sacral therapist. I have an appointment in 2 weeks, but kind of talking a little silly still. And I was in a lot of pain. I mean, the last 2 days, it wasn't like, super easy, but it's getting less painful. I'm still getting used to it, obviously. But yeah, I don't know. Chip's not so sold on all of this yet,
Not at all.
but you've seen Declan, his jaw structure from like the side, his teeth all on the bottom, like now he has room at Cyrus.
Just really, really, really expensive. Way beyond braces, which is insane.
Yeah, but it's like a functional it's just like integrative medicine. If I would have seen someone like me when I was in high school, I like we wouldn't still be paying for my thyroid
But these
meds.
dentists are making millions of dollars a year.
Yeah, well, maybe I should have went into functional.
That's what you should. You still could.
I'm not going back to school.
2 years.
Money isn't all. No, I don't want to be doing that. But I think it's you have to think though, the reason why the appliance costs money, plus it's their expertise. So you can go and you can get something cheaper, but it doesn't mean it's going to work well. And kids with braces, like they just move the teeth around in this little space. And even like I hate when I like see other kids and they're like mouth breathing and I'm like, should I say something to the parents? How well do I know them? And it's just, you just pray they have eyes to see and ears to hear because if you don't fix this stuff now, it's gonna cause problems like Chip. You need palate expansion.
I had it as an adult. My parents couldn't afford braces when I was a kid because we were poor.
You got palate expansion as an adult?
Like you're getting palate expansion right now.
What device did you?
Palate expander that I had to crank every day.
How old were you?
I mean, I met you when I had braces.
Well, yeah, I remember
Like
you
2 years. I had a palate expander, yeah.
but I feel like they didn't. Well, obviously they didn't do enough. Your arch is like really high.
I mean,
That's
yes, if
nuts.
you can't get a lot of expansion in an adult, then
Well, what about the Vivos with the stem cell? Well, I guess
it actually doesn't do anything with that. Like it used to when it first came out, it said it was gonna like stimulate the bone and stuff. It doesn't. It's literally just there's like it cranks in 2 different spots.
Mhm.
So it's like a more even expansion. I don't know.
Well,
We'll see. I don't know. But that's the thing too, right? There's a dentist up in Louisville that it's like $4,000 for this Vivos, but down here it's like 10,000.
yeah, but that's also in Franklin where it's all the celebrities.
So you see,
And
yeah,
yeah, and it's also expensive and it's just, what do you want to spend your money on, and its health is so important and making sure my kids have good airway. Growing up. All right, let's move on to the other topics. We're gonna try to keep these 20 minutes. Chip, okay, remember, so I want to like get back into crocheting, or knitting. I want to learn how to crochet. I used to knit in medical school. It was like what I would do. And I want to, what's wrong with crocheting? I just like have busy, like I always have to do something. Like, wouldn't it be better for me, like in the car, just to like talk with you and crochet a little instead of working on my computer?
yeah.
See? Okay. But so I go into the barn and I find all of my yarn because, of course, I kept it.
She's also a rapper. I go into the barn and I find all my yarn.
That wasn't on purpose, but should I rap?
Like Dr. Dre, Dr. J.
No, more like Lecrae. So I went in and I was like looking at the yarn and I'm like, it's all polyester. And I'm like, okay, well, that's fine. I won't be wearing it. I'm just going to be practicing with it. And what did you say?
You're so crazy about fabrics being all cotton. Why are you going to use polyester yarn? You're going to be touching it all the time.
Touching it, yes. So I was thinking how I'm like, be fine to practice with because I'm just going to be it's not, no one's going to be wearing it, but you had the point of saying it's like in your fingers and you're going to be working with it. And I'm like, oh my goodness, that is such a good point. I can't believe he called me out on that. So now I'm going to have to, well, I found those dishcloths that I used to make and my mom still makes. That's cotton yarn. So I've been practicing with that and I'm going to have to buy some cotton yarn, but it just made me think, because what won't we let our teenage son wear?
Polyester underwear?
Right, right. So I want to bring up some studies.
Well, it's crazy talking about that. Like they're doing, I told you about this. All that urologist in Cleveland is doing like their marine pathology, like on penis tissue. And they're
Yeah.
finding microplastics in like penile tissue in these men, even young men. It's crazy.
And these are men that are confused about their gender.
These are men that are getting their penises cut
Possibly.
off.
Yeah. So microplastics would be BPA and affect their testosterone.
I mean, actual microplastics, so not just BPA, like
Microplastics.
actually plastics.
Well, drinking out of plastic water.
Yeah.
Well, that's what like that coffee maker I want to get. Maybe they'll sponsor me. Maybe they can sponsor one of these. Like, I don't want plastic touching, but the only thing that removes that is full body, total body plasmapheresis. So that's the next thing we need to save our money for. Bloodletting too, like the firefighters with forever chemicals, that would also technically get some of the microplastics out. That's just a donation. You do too, because you're bloodletting. Chip is the universal donor, and men, we're way off topic, but men should be donating like every 6 months.
They're gonna give me $30 if I donate blood. They said a $30 gift card.
You can get some cotton underwear.
It's like I'm donating plasma in college,
Yeah. Well, no, don't. Okay. So this study was done on female dogs. Okay. And these test groups, they did different textile underpants. So they made these dogs wear underwear, either 100% polyester, 50-50 blend, cotton, or wool. They wore the pants, these dogs, for 12 months. So they were looking at these electrostatic potentials. Okay. And they also measured these on the textile covered skin. And the ones wearing the polyester textile showed diminished serum progesterone and they did not conceive on mating or insemination. Okay. So I think that's so interesting. So it basically caused a lack of ovulation because ovulation is then going to be stimulating the progesterone. So that study was really interesting, and they're looking at this electrostatic potential, as this electrostatic field may hinder ovarian activity and potentially lead to infertility. So that was that one study on the dogs, and I just imagine these dogs wearing, these cotton underwear. And then they also did a study on males. So don't leave the males out. Male dogs, 24 dogs in 2 equal groups. One wore cotton underpants and the other polyester. 7 dogs wore nothing, and they were used as the control. And the underwear was fashioned to fit loosely in the scrotal area to avoid its insulating effect. So that's nice. And it was worn for 24 months. And they looked at the semen character, testicular temperature, hormones, and testicular biopsies. So the polyester pants had a deleterious effect on spermatogenesis in the dogs. However, it was reversible. So that's interesting. And once again, they think that it's this electrostatic potential. So, I mean, I guess that's the good news, is that it seemed reversible, that inhibition. But the testicular biopsy actually showed some degenerative changes. And there was that decreased sperm count and decreased sperm and increase in abnormal sperm. I mean, none of this is what you want, right? I mean, what kind of underwear did you wear like before we were together? I mean, but when you're that young, it might not matter.
I wore boxer briefs, I think.
Yeah.
I don't know. Just running under. I don't know. Probably a blend.
Yeah. I mean,
Oh, no.
it's
I
hard.
don't know.
Cotton.
I don't know if they're cotton.
They are.
I don't know. We've never looked.
I,
I need new underwear, actually.
well, maybe.
Got holes in them.
So this was another study that looked at male volunteers, and this study was out of Egypt, and these 32 to 47-year volunteers, they wore a polyester scrotal sling day and night for 12 months.
It's like a male dancer.
To determine if polyester fabrics can act as a contraceptive in men. You would think all these liberal women would be over this, right? Like, look, men can have birth control. Anyway, all right. They changed the sling only when it became dirty. None of the men dropped out of the study.
This is in real people.
Yes, and men at the Faculty of Medicine at Cairo University. Oh man, this is hilarious. Okay, so the sling did not cause any complications or reactions. That's great. Their partners took an oral contraceptive until 3 sperm samples proved the men to be azoospermic. The men became azoospermic from 120 to 160 days after first putting on the sling and remained not producing sperm throughout the study. None of the partners became pregnant during the study. All 5 couples who went into pregnancy after the study period did conceive. 4 had live births and 1 miscarriage.
I wonder what kind of underwear Greg wears.
Oh, honey, this is going to be on our YouTube.
That's okay.
You can ask him.
I'll ask him. He's my
I
friend.
think he's probably thought of that. We'll tell him not to wear it.
Yeah. I get you watch this. Do not wear a polyester sling on your balls.
So their volume of the testes fell during that month, but returned to pre-test levels 75 to 35 days after. And this again was talking about this greater electrostatic static potentials. Because I honestly, before diving into these studies, I thought the problem was how polyester is toxic and microplastics, but it's really just this like potential understand. So you're wearing polyester right now.
Mm-hmm.
And this is cotton. You're in all polyester.
Yeah.
But if your underwear is protected, that's going to keep, if it's wool, how do you wear it? Would you wear wool?
No. Did you never? You should wear wool underwear.
I just don't think that would look good under clothes.
What?
I wear cotton. That's pretty good. So, ladies, the other interesting thing is all of so much as the underwear now, it's like the crotch isn't even cotton, and it's like, anyway, you should not be wearing polyester underwear. I mean, I think this is pretty interesting. I wonder, I want to dig in and see if they did any studies on bras and the electrostatic potential, but anyway, those were most of the studies that I looked up with polyester, just like underwear I thought were interesting. But we do know that another problem with some of these workout pants are they have forever chemicals on them, like the wicking and stain free.
I think it's because like women now all wear yoga pants all the time, every day, all day, like every woman out there.
How many days a week do I wear yoga pants?
You used to wear them almost every day.
No, every day. I would ask Anna, like, no. Okay, maybe like 2 days a week. I would not wear them every day.
What?
I was in for the last 8 years, I had my office practicing and I would like wear cute outfits.
Sometimes they were yoga pant-ish type pants.
I don't know. I feel like that's kind of We hit our 20-minute mark anyway. What do you think we should talk about next week? And
Cows.
all right, sounds good.